That's Danko for you. This is Tina Nzuki.
And of course, this is a home of fresh and classic.
Seriously.
It's Pearl Radio. Sisi tuko na Yesu bado, don't think.
Bado. We are with him. And we're live on www.pearlradio.co.ke.
That's right.
You can check us out there. Plus, we have a stranger in the house.
The house. Wacha karibia hapo.
This thing doesn't bite, so we need to hear you. Karibia.
Ni number 4.
Karibia hapa.
Good morning.
Wacha tumchezea release.
Hold on. Now you need to come forward.
There.
You know, here in the studio, we teach people 101 studio.
Yes. Studio 101.
You ever been at a radio station?
Yes.
And what about a TV station?
Yes, I've done a number of TV stations. NTV, KTN.
Good stuff.
I've been at Radio Mini.
So you're a well-known face.
Yes,
Now,
yes, I am.
now you get to hear the voice.
Yes.
Yeah, sure.
Yeah. Introduce tafadhali.
And I'm happy to be here this morning.
Yes.
My name
Not
is...
to be sad, by the way.
Oh, great. Yes, of course. Making a good choice to be here this morning.
Right.
Thank you.
My name is Richard Wafula. I'm a counseling psychologist. I work at Money Counseling Center. And I love doing this. I love reaching out. I'm a trainer. I'm a counselor, like I've said. And I'm looking forward for this great morning to just talk about depression.
That's right.
Yes.
In women. So I'm looking forward for this show, just to encourage our listeners to send in as many questions as they can,
Yes.
so that then we can be able to interact and be able to give more info on this very, very, very important topic of depression.
Richie.
Yeah.
And allow me to call you Richie.
Yeah,
Some people
sure.
be like, he's a guy. What would you know about depression in women?
Wow. Yes, I'm a guy, but like I've said in my interaction, in my area of practice, of course, I've been able to interact with women. I'm a human being as well. There are women around me. I'm married. I have, my sisters around me. I have friends.
Yes.
And so, yes, I'll be able to talk from a point of information.
Right.
And I'm pretty sure that I've been able to gather enough research on this topic.
All right.
How long have you been a counseling psychologist? How long have you practiced?
This is my 13th year.
13th.
This is my 13th year
Right.
in this profession. And I'm looking forward to having more years.
Many
more years.
Yeah.
Kuna swali moja everyone wants to know.
Okay.
We take our problems to counseling psychologists.
Yes.
Yes.
Who do you take
counseling
your
technology?
problems to? Uko na nani?
Wow, good question.
Yes.
I mean, like I've said, I'm a human being, and therefore,
Right.
as much as I'm a counseling psychologist, and of course, people have been bringing their issues to us.
Yes.
There are times that I also go through issues.
So who do you offload onto?
My fellow counselors. We
For
have,
real? Okay.
Yeah. I seek therapy. In fact, it's one of the professional standard. We are expected to also seek therapy whenever we go through our issues. We
Yes,
expected to
yes.
go through supervision.
Okay.
So I go through supervision myself to present the clients that I've seen over a period of time. Some of the clients will be very difficult. Some of the clients will give me better insights. So
Okay.
I seek supervision to be able to deal with that. But I mean, as a human being, I've gone through personal issues. I've gone
okay.
through losses.
Right.
I've gone through emotional issues. Stress to that effect, and
Ooh,
I've
my
been able
goodness.
to
Yeah.
reach out and also seek support. Mtu alisema mganga ajigangui.
Ajigangui kabisa.
True story.
Mwerevu ajinyoi, eh?
Well, we're gonna welcome you with a fantastic song in just a
Yes,
few minutes.
yes.
But is it true that depression is different when it comes to gender?
Yes.
Men handle it differently from women.
Yes.
And the depression is different.
Oh, yes. Research has shown that,
women
are twice more likely to be affected with depression than
Yes.
men.
Oh.
Research goes further and
Twice
say
more likely.
that about 20% of women are likely to experience depression in their lifetime. 20% is not just a statistic, this is quite a high figure. Yeah.
And what would be causing that? Would you, just a myriad of, from the top of your head?
Yeah.
What's the first thing that comes to mind? Or the top three, probably.
Wow, a number of things. Biology and hormone. And maybe we'll be delving into it in our show.
Yes, okay.
Psychological factors. And when I talk about psychological factors, I want to mention that women are more emotional in nature, and therefore issues to deal with the psychological matters will affect them more.
Right.
Okay.
Psychological matters.
Yeah.
Okay.
And we'll be talking more about that. But also the other major aspect that will cause this is the social factors. Okay, social factors.
Yes.
And the number of social factors, of course, when we'll be talking about it in this show. But just allow me to say that the way women cope, the way women make decisions are very different from how men cope and make their decisions in life. And therefore, that will really explain, my first statement that women are twice as more likely to be suffer from depression than men.
Okay. So we're going to answer this in when we come back.
Okay, sure.
But you're going to confirm that stories have been told that between when COVID struck till now, you guys have been the busiest in the industries.
For real. Oh my goodness. You're listening to the voice of Richard
Wafula, who's a counseling psychologist, and he's here today to answer all your questions along the lines of women and depression.
Yeah.
It could be postpartum, it could be normal depression, kawaida. We're going to even delve on the different types of depression. Yes. So if you have your questions, you can send them to 0702 969 969. That's 0702 969 969. You can text or WhatsApp there, or you can call us on 0701 969 969. We know you've got a story. And this is the home of fresh and classic hits, Pal Radio 96.9. This is Pal in the Morning. My good name is Danko Talako.
And my name is Tina Nzuki. And
Richard Wafula.
That's right.
He's our counselor this morning. We're talking about depression in women.
Right.
Just in case you hear another voice later on in the next hour, it's a voice of a lady who has an amazing testimony.
Right.
You will not go wrong with this one. But remember, we're taking your calls and we're taking your phone, your text and your SMSs on 0702 969 969, or you can call on 0701 969 969. Now, on to some questions this morning that some of you had asked earlier.
Right. So there's this man. Yes. You know, when we talk about depression in women, and people are wondering, so as men, and I'm actually going to talk on behalf of the men, because how do we find out? So we need to find out how different is it in men than in women, because there's a husband who has realized something. Can I read the question?
Yes.
Yeah, go ahead.
So slightly enough 4 months ago, my wife and I were blessed with our first child, a son. He's such a handsome fellow, taking after the father, and has a powerful set of lungs, I must say. Night shift ni noma sana. But I noticed that my wife has begun to have mood swings and irritability that has no explanation. And she will hurriedly breastfeed the baby and then not clean up after her, and will not also burp our son. She says she's very tired all the time and will not do any housework. Is she depressed? How can a man tell that the wife or sister or daughter is depressed?
Okay.
Yes.
A number of things, because then that question will point to what are signs and symptoms of depression.
Right.
Okay.
They really are not so different from men and women. But what are these signs? I think I've heard from that question this gentleman mentioning some of the signs already. Okay. Anxiety. Anxiety will be one of the signs that perhaps someone is going through, depression. Insomnia.
Oh,
okay. Insomnia, lack of sleep, or better still, there are those who sleep too much during when they are going through depression.
Wow.
Okay. What else can tell? Fatigue that is not explained.
Yeah, because she kept saying she's tired all the time.
It's a beautiful morning like we're having today. We expected that you wake up like I did this morning. I was feeling very energetic. I knew I'm coming to Power Radio, and I was looking forward with full of energy.
Right.
But if there was something going through my mind, then I would, be here looking very tired. Because of the mental exhaustion during the night. Either I did not get enough sleep, or there were so many things that were happening, going through my mind, that I've not been able to process very, very well. Irritability. Okay? Irritability and anger outburst.
These are something not rested. It's not rested on anything at all.
Yeah,
right?
it's not rested on anything. Something. even like a greeting. Danko, how are you this morning? Why are you greeting me this morning?
Yeah.
So I mean, and you get to wonder, what is causing that? What is really causing that?
Yeah.
Confusion. Okay, confusion and forgetfulness. As a cognitive sign that someone could be going through depression. Just pick something you want to do, you leave it. I mean, you are all over the space.
Right.
You don't know really what, where, and how you want to do things.
Right.
I mean, you just did something, and the next time somebody's asking, but they remind me what you have just done. You can't remember.
What?
So those like blackouts, what are those?
Yeah, those will be, a mental blackout, because then what will make you forget something that you have just done, maybe even yesterday or even this morning?
That's
Right.
What will make you forget? It entirely will point to the fact that you're going through something emotionally, mentally, behaviorally that is causing that forgetfulness.
Now you have a husband who's watching all this happening.
Yeah.
What can he do apart from now running away? Because that's probably his next flight.
That's true. That's true. That's the
because
most-
Yes.
he does not know what to do.
Yeah.
Yeah.
I think people have labeled people suffering from depression. Unfortunate to say that people have been stigmatized. There's that social stigma when you come out to talk about depression, then you're
Right,
looked
right.
at as either bewitched, or something just out of the norm.
Right.
And therefore, as you see these signs and perhaps many other signs, what do you need to do? I've always said that depression is a sickness just like any other sickness. You'll want to take care of this person like you'll take care of someone who's having malaria, who's having cancer, who's having other sickness. I mean, when someone is going through depression, one of the things that will be very, very important is social support.
Social support.
Yeah.
How does that look like?
How does that look like? One, accept me the way I am at that particular time without judging, without labeling, without calling me names, without imagining that I have been bewitched or my grandmother, my grandfather has thrown things on me.
You got to get a bit practical. Do I sit down, look at you, and wait for you to say something? What do I say? What do I not say? Yeah, so get as practical as
So
possible.
the practical aspect is one, is to have the skill of empathy. Empathy is to get yourself into the position of the other person.
Uh-huh.
Putting yourself in their shoes.
Yes, in their shoes,
Yeah.
and actually listen. Listen actively. Listen to understand. Don't listen to respond to these people. Listen to understand what they're saying. Be patient with these people. That's the practical aspect of the social support that we're talking about. Help them where they need help, physical help. If I need a glass of water and I cannot go and pick it because then I feel I have no energy to wake up, please go and pick me that glass of water. If I need to go and get food prepared and I'm not able because
to.
of what I'm going through,
You do
please
it.
go and prepare for me that food.
Okay.
And that is what we expect of the people around us, and including the husband who has just asked that question.
Yes.
There's a 4-month-old baby
Yeah.
that is involved in this situation. Mom is not feeling very breastfeedy right now. What then does he do? What would you suggest he does in this time?
Okay.
Yeah.
I mean, I want to, empathize with this situation, and I want to take the role that I'm the husband. And
Yes.
I'm having a wife with 4 months who's not, feeling like breastfeeding,
Yes.
as you're saying. I think I will offer practical support where I will take up the role. I may not breastfeed,
Right.
but I'll, of course, feed this child. Okay. There's formula.
Yes.
Right.
Okay.
It's bottle formula.
Bottle,
Yes.
yeah, So why can't I spend more time with the baby and allow the mother to rest, for example?
Right.
Okay?
Yeah.
Because rest in itself will be a therapy to this person who's going through this depression.
There you go. So rest.
Yes.
Okay.
Rest is as important as other techniques of managing depression.
All right. This sounds good. And I hope your questions are being answered this morning. We're going to take a short break, get into sports. And when we come back, maybe Richard, you can go ahead and tell us whether bipolar, someone's asking this morning, is bipolar a form of depression? What exactly is it? Remember, your questions can come in on 0702 969 969, or you can call straight up 0701 969 969. 10 minutes now to 8 o'clock. You're on the station that's a home of fresh and classic hits. We're Pearl Radio 96.9 live on www.pearlradio.co.ke. We have a wonderful guest on the way, another guest. Her name is Priscilla, and you'll be listening to her story about postpartum depression and also depression.
Right.
And let me tell you one thing, you just get that Kleenex box right next to you. Tears are gonna flow. But we have a wonderful counselor with us this morning. His name is Richard.
Yes.
And Richard has been with us for 25 years. I'm kidding. Richard's probably saying, are these people, can you tell if any of us would be depressed? You'd tell immediately.
I'm almost thinking, are you depressed?
Oh, you haven't seen anything yet.
You have seen nothing yet.
Right, and so we're taking your calls as well. 0701969969. Let's just take one call.
Correct.
And
Go
then
on.
we can continue. Good morning, you're on Pearl.
Good morning.
Morning, how are you?
Fine, thank you.
Who are
Go
we talking
ahead.
to?
So, Dr. I wanted to ask a question. So, I lost my job before giving back to my son. That was around 2019 there. So, I've not been able to get a different job. And, now going back with the kids back home. So, everybody tries to tell you should get your own job. You should be able to sustain your own kids. Besides, you went and gave back to kids anyway. So, my problem is, anytime my son refuses to stop crying, I find myself like I want to strangle him. Then, after a while, it gets to me, what am I doing?
Wow.
Yeah.
Wow.
Okay. So I'll allow Dr. is going to answer you. Thank you so much for your call.
Okay.
All right, thank you. Wow.
Wow. That's a story there. I mean, I'm picking a number of things. To do with her emotions. One, as a result of the loss that she had in terms of losing her job. In 2019, up to now, she has not been having an income. Perhaps being the only parent to this child.
Yes.
And because of the social pressure in terms of the finance, in terms of the care to this child, this person is getting overwhelmed. Okay, it's getting overwhelmed emotionally because then she's not able to provide as she had expected, or rather as is expected.
Yes.
And therefore this emotional load, if I was to call it that way, is actually now translating into an action that is not very, very good. Okay, and that's why she's talking about wanting to strangle this child.
That's right.
She's just basically displacing or projecting her anger, her emotions, her frustrations to this innocent child.
Yeah,
And it's
yeah.
bound to happen, and especially if you have no outlet. Okay? If you have no
Yes.
outlet.
Yes.
Psychologists say that what comes in to a human being has to come out somehow.
All right.
So this lady has taken in so much in terms of the misery
Yes.
that she's going through, the frustration that she's going through,
Yeah.
and the
Gosh, I can
only
imagine.
outlet is this child. And therefore, I just want to encourage this lady to
Yes,
reach
please.
out.
Yeah.
Reach out to counselors. Reach out to us. At a money. Reach out to me. I'll leave my contact.
Yes, please. Yes.
So that then we can be able to help you deal with that stress as a result of the loss of the job and perhaps other underlying reasons.
Yes, yes.
It may not just be the loss of the job.
Yes.
There could be other things that are forcing this lady to get to where she is.
There's one thing that she, in particular, that she has talked about. I think there's also humiliation, a lot of humiliation, because she has had to move back to her folks' place, move back home with her kids.
Correct.
So humiliation is also a very big, and of course, that really plays a big role.
Yeah, so change of status.
Can also...
Change of status is one of the causes of stress,
Right.
and to an extent, depression. I can imagine, I mean, at some point she had her own money, she was doing well.
Yes.
I mean, she had defined herself in a certain way.
Right.
And there goes the job.
All right.
There goes the job. So change, I mean, change
can also go ahead and... Richard, remember before we took the break, someone asked this morning, is bipolar a form of depression? What is it?
Yes, it is. Bipolar is a form of depression. It's characterized by two extreme moods. Okay.
Wow, yes.
When I say two extreme moods, is that how does one, present a bipolar, symptoms? Is that at one particular time you're extremely happy, the other time you're extremely low, and extremely sad.
Yes.
Okay. And therefore, I mean, there are people who do things in that situation, in that condition, that they may not even able to explain themselves and what caused them to do that. Just last week I had a client who was presenting a case of separation as a result of the husband having the bipolar condition, where the husband at some point used to come in without any trigger of a conflict. The husband would get into a physical fight.
Without any trigger at all?
Without any trigger at all. But the other times, when, he's okay and he's happy, when he's even told, yesterday this is what you said, you abused me, we say, no. I mean, it's not me. I mean, no. So, sometimes we refer to this condition, as you see the way a chameleon changes?
Yes, yes.
With colors, I mean, depending on where they are. So that's how, one presenting a bipolar condition will be, having two extreme, sets of emotions.
We got someone this morning. I have a history of bipolar, and I've experienced both postpartum depression and postpartum psychosis. In 2010, I delivered my baby while still in campus. Exams were around the corner, and the baby was on oxygen support for 2 weeks. The guy responsible took to his heels. This was too much for me, only for the baby to pass on later. I lost it. In 2017, I experienced postpartum psychosis. I was really irritable, disorganized, and had postpartum rage. All this was managed through medication, and I'm doing well. This, of course, now brings the question between postpartum depression and postpartum psychosis. There's a difference between the two, and what is it?
Postpartum depression is, of course, caused by, the physical and the hormonal changes, and especially for the new mothers.
Only new mothers?
Not just the new mothers, but mostly experienced with the new mothers.
Okay. Mostly experienced.
Because of the experience of, bearing a child for the very first time.
Correct.
The body changes, the physical changes, the hormonal changes would really result to the postpartum depression. Postpartum psychosis is just an escalation of the postpartum depression.
Oh dear.
Okay. When you say postpartum psychosis is a situation triggered by postpartum depression, because then this person may not have dealt with the postpartum depression very, very well.
Yes.
And therefore it ends up leading to postpartum psychosis. And you have also heard her talk about postpartum rage.
What is that?
Okay.
What is that in your view? What is that?
So basically postpartum rage is where this person was experiencing a lot of, how would I say, anger as a result of what she has already gone through.
Right.
Anger that she has not been able to deal with, deep anger issues, vengeance kind of that she has not been able to deal with during the postpartum depression, and of course that led to the postpartum psychosis. I'm, however, happy to learn that she has been treated and she's doing well.
Wow. You're listening to the voice of Richard. He is a counselor at Amani.
Yes, counseling psychologist.
Counseling psychologist. And
Yes.
Richard is, of course, going to give us his contacts just in case you
Yeah.
want some one-on-one with him.
Right.
That'll be fantastic. We are Pal Radio 96.9. Today we're discussing women and depression. Made to understand that 20% of women do go through depression higher, slightly higher than men.
Yeah.
And the depression is absolutely different. We have a friend this morning said, could you touch on single moms? As it seems, according to her, she's in a group.
Yes.
And single moms seem to be more hit with depression than any other group she knows of. What is your take on this?
Okay. What will cause single mothers to experience depression will be a number of things. Number one, the loss of the relationship in the first place. Women are ideally emotional
beings.
beings, you know, and the way a woman will respond to a separation or a divorce may not be the same way a man would, you know, respond. Perhaps I'll ask Danko to talk about men.
Danko.
Kuuliza maswali za wanaume bwana.
Ni wakati ya wanawake.
So the depression starts from the point of separation,
Right.
From the point of divorce,
Right.
but also because of maybe financial, pressure. Okay, it may not. Okay, it's not the only reason. Because then there's some women who are able financially to take care of their children post, their marriages.
Yes.
It could also be that they're overwhelmed by parenting.
Okay.
Parenting as a single mother, and especially parenting a boy child,
Is hard.
may present a challenge.
A challenge.
May
Okay.
present a challenge. So
Yes.
parenting in its own may actually cause depression, to some of these women. Society's, expectation and definition of a single woman is very, very different.
That's right. That's right.
A woman seen to be single is seen to be as a failure. Okay.
Yes.
So one can easily, succumb to that, what the society is thinking about this person.
Correct.
We exist in a society, and of course, we sometimes behave according to what the society says or expects of us. So if this woman, gets to that trap of, seen as a single woman, I'm not a successful woman, I'm a failure.
Yes.
That in itself, that thought can lead to depression as well.
Okay. And of course, this is Danko Talaku and of course Tina Nzuki. The show is Pal in the Morning. Today we're talking about women and depression and what they have faced and suffered in the hands of this disease, because we have just learned it's a sickness.
It is a sickness.
Like any
Depression
other-
is a sickness.
Yes.
And just before we took the break,
Yes.
the men. Listen, gentlemen, we're not crucifying you. We're not putting you in a position. But because it's women and depression that we're talking about this morning, just before, Priscilla, say hi.
Hi, good morning, folks.
Hey, okay, ndio hiyo.
Alright.
Unasikia kuna sauti nyololo ya kutoa nyoka pangani. Yes.
Right.
She's going to tell us a story.
Right.
But you were asked a question, Richard, and
Yes.
it's not bashing men, but it seems that sometimes men are caught flat-foot.
Right.
What do we do?
Yes.
And the question, Duncan, was
Are there ways
They contribute.
we enable or contribute to depression unknowingly? Yes. So the men are asking.
Yes, there are a number of ways that
Yes.
Men will contribute to depression in women. I'm not very sure knowingly or knowingly, but let's look at how men will contribute.
yes, yes.
How we treat, how we relate with women,
Right.
would actually enable or have them not get into depression.
Right.
Oh, okay.
The things that we say, the words that we use, the actions that we, show that will really be very emotional, to the women. Okay. Some of the times, the words that we use, we may not really, take responsibility as the reason as to why one will be depressed.
Yes.
Okay. Somebody say that a physical pain is better to deal with than an emotional pain.
Ooh, very true.
Yeah.
Yeah.
And therefore, the words that we utter
As men.
Yes. sometimes can be very destructive. Very, 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 very destructive.
Right.
Okay. Like I've said, sometimes we utter those words to na chana nazo hapo, we move on.
Like, life gone.
Like I say, Priscilla, you're looking very ugly this morning. I don't know how I met you. And I've gone.
Ouch.
I've gone. For me,
Ouch,
that
ouch,
will
ouch.
not really be something to, pay much attention to.
Right,
But you see,
right.
the one I've told will remain asking herself,
Honey,
Am I that ugly?
am I that ugly?
ask yourself that question. Yeah.
Or sometimes we treat our women as if they really, really are not very important to us. Silent treatments.
Doesn't start with women.
Yes. There's some men who
Men
are
actually have perfected the art of silent treatment.
silent treatments.
Yes.
You don't want to talk. Richard, are you okay?
Niko sawa.
So, can we talk about this? No, not now. I'm busy. I'm busy doing my own things.
Wow.
For me, and that is more reason as to why men and women respond differently to depression, because women would respond in an anxious manner.
Right.
Men will be very guarded. Very guarded.
Tunaogopa drama sana.
Tunaogopa.
Hatutaki drama.
Hatutaki drama sana.
Sana.
Drama festivals.
So basically, our interaction, how we talk to them, how we treat them, would actually, directly or indirectly contribute to the depression in women.
Right.
Yeah.
Wow.
All right. We're going to go ahead and introduce our wonderful friend Priscilla.
Yes.
Uko relaxed, uko poa?
Niko poa kabisa.
Nitateremsha hii kidogo, as Danko,
Yes. Iteremsha kidogo.
Okay. So Priscilla, how are you this morning?
I'm good.
You good?
Yes, I can't
You need to come
complain.
straight right here. You see right here?
Yes.
You can lean forward. Just lean forward. Lean forward. That's
Fantastic.
Yeah. If you lean forward, as in huja mbele hivi.
Yes. Much better.
Yeah, much
Fantastic.
better.
Yes.
And you told us your story for us.
Yes.
And it's a story about what you have gone through.
Yes, through my postpartum, and I also underwent depression.
Wow.
Okay.
It's something that I never knew that I was going through. When I got my baby girl, that's Megan, 2011 there, I was very much okay. But I had completed my college level at JKUAT. I lost my mom when I was in Form 3. So during those times and moments, I never had time to mourn my mom. I came from school, I was in Form 3, went straight and we buried my mom, and we came back home, and I went back to secondary. When I went back to school, no one talked to me, not even my dad, and I stayed for like 2 to 3 years, still mourning my mother. Then from there, later on, I joined college. After joining college, I got engaged to a wonderful man called Moshemi, whom we got a baby with. After getting a baby with, we started having issues due to the tribe, something of that sort, because I was from Ukambani and he was from Kikuyu.
Okay.
So I assumed all that. I never shared that with my parents. I kept it to myself.
Right.
Then
Okay, sorry. Go on.
Then my dad remarried.
Right.
When my dad remarried a beautiful lady who is almost our age. So you can picture that gap.
Yeah, yeah.
So things didn't really work out for us. So I decided to leave home and I joined Moshami and we lived together. So when I got my baby girl, I developed the postpartum.
Postpartum, yes.
Yes.
I used to hold on her. Sometimes I'll forget that this is a child. Yeah?
Yeah.
I'll just wake up,
Yeah.
throw her to the bed, and walk out of the room.
How old is the baby at this time?
At that time, she was around, I think, 2 weeks.
2 weeks.
I started with 2 weeks.
2 weeks, okay.
Yes.
Okay.
So
Okay.
she would cry. I would hold my ears, and assume there's nothing happen.
Were you alone at this time? Were you living with somebody?
I was living with my mother-in-law,
Okay.
and I thank God for her
Yes.
because she really supported me during that time.
Yes.
Because she realized something was wrong with me. Yeah. So what she decided to stay with the baby at that young, early stage.
Right.
She took her to her bedroom, and I was told just keep off.
Okay.
Yeah. So I would come breastfeed for 2 to 3 minutes.
Right.
And then I stopped that. And then I developed that attitude of, I don't care.
Right.
I would see the baby and I would say, this baby doesn't belong to me. I don't need a child. So I stopped breastfeeding.
Where were these thoughts coming from? Did you have a defined place from where they're coming from, or was it something that you just...
It was a feeling that was coming. And I
Right.
think it was also being triggered by when I delivered my baby girl. When she came out and the doctor announced that you have a baby girl, my former husband left. He literally walked out of the labor room.
Do you think he wanted a son?
Yes.
He wanted a
That
son.
was the cause of everything. So the mother was like, no, I will not leave you here. She just came to where I was. We cried together. I was taken to a room. And actually, I discharged myself. I did not wait for the doctor.
You discharged yourself,
Yes,
Priscilla?
I walked to Dr. Wanyonyi and I said, I need to be home. I don't need to be at this place.
Yeah.
Let me go home. And he said, Priscilla, no. We need to monitor you for 2 to 3 days. And I said, no. I thank God. I did not go through cesarean because I was booked for a CS. And during that time, Dr. Wanyonyi just came in when I was being wheeled to theater.
Okay.
And he said, no, Priscilla has been a very good close friend to me. And I will not allow her to go for a CS. So he pulled the bed and I was taken back to the labor room.
Yes.
And he said, Priscilla, tell me what you need right now. And I said, please, can I just get a cup of cold water? And the moment I was given that, he just said, Priscilla, you need to push. And I pushed.
And baby was born.
And the baby was born.
So now we are home. We have a 2-week-old baby. Your mother-in-law has taken the child.
Yes.
You're being told to keep off.
Yes.
What's going through your mind at this time?
Now, what is going through my mind is, do I really need to be in this relationship? Do I need this baby? No. I need to do something about my life.
Sure.
So I would wake up in the morning and I would just go.
Where would you go?
I don't know.
Anywhere.
Anywhere. And then I'll come back home. I don't remember if I have a baby. And I would sit down.
Would the breast at least be, the milk, would it be pouring out? Would you?
It would,
did you
but
notice?
yes, but I kept on just assuming. Yeah. Until now, it reached a point, and my mother-in-law was like, "What's the problem?"
Yes.
And I said to her, "I don't have a problem," but she could tell.
Okay.
So I did. We went on living like that, and then later on we just separated because the guy could not understand
Correct.
what was happening.
Sure.
What's the time period? Yeah. How long was this?
We've separated like I'd say 10 years right now.
Okay. And during the time when you were ignoring the child, how long was it? When you'd go and come back?
Now that was from 2 weeks until now. The baby was like around 9 months.
Wow.
So now my 10 months, now when we separated, now is when I started saying, because now it was me, my daughter, and my house help.
Yes.
So I was like, what am I doing to my child? So now I started yes.
Coming back to your senses.
So now I tried to come close to my daughter, but still I could find that I don't have that mother feeling of, you know.
Maternal
Yes,
instincts.
maternal instincts are not there completely.
Did the child feel the same, would you say?
Yes, she felt. Because my daughter, actually, we stayed like for the 9th month, then the 10th month, my daughter started like behaving funny at night. She would cry. She would call the grandmother that time. So I decided to take her back to the grandmother.
Yes.
And the grandmother stayed with her like for 3 months. And then I said, no, I need to get my baby back.
Okay.
So now that's when I brought my baby girl back home. And my dad started talking to me. And I thank God for my father.
Yeah.
He brought us alone. But I would say my dad tried. He tried a lot. So now from there, I resumed now to my responsibilities as a mother. We started going out with her. We started telling stories. Actually, even we'll sing. And I remember there's a song we used to sing so much for Isaac. Is it Isaac Ahora? Then Jaora Merigo Yako.
Yes,
so we used to stay together with my daughter. And we'll kneel down in the bedroom.
Okay.
And my daughter will start singing Jaora Merigo Yode. Because I used to love that song.
Yes.
So we just went on. And I got over it.
Yeah.
I did not go to hospital. I didn't even inform my doctor, who was Dr. Wanyonyi, what I was passing through.
Yes.
You didn't take any medicine?
I didn't take any medicine. I kept it to myself. But I remember what kept me moving on is this issue of going to church. I had friends who used to invite me to their places, and they would tell me, Priscilla, today we have a Bible study.
Right.
So we used to go for Bible studies every night. And I used to go to Katoloni for prayers. I would leave my daughter at that young age with my house help.
And
I
go
would
to
go to Katoloni. It's in Kadhiani, Machakos.
Yes.
I would go there for 1 week. I am
And your
still
daughter is at
employed.
home?
Yes, I'm still employed. And I would go, I'll tell my boss at that time. I would tell Anne, listen, you know my problem and you know what I'm going through. In my situation, it's only God who can help. No one else.
Yes. Sorry about that.
So the boss was like, Priscilla, I know what you are going through.
Yes.
So I'll allow you, I'll cover it up for you.
Right.
So I would go Katoloni and pray for 1 week
Right.
and come back. And things changed. Believe me, things changed.
Would you say prayer helped you?
Helped me a lot.
Yeah.
Yes, because going to friends and telling them what I was going through.
Yes.
Knowing that who friends are.
Yes.
Today you'll talk to so-and-so, tomorrow so-and-so, and nothing will come out of that. Actually, what will come out of the friends, it's pain. Because one thing, they will go to work.
Right.
I remember there's a time my dad was called and he was given some nasty information about me, that I'm not working, I am not performing. So instead of my dad to come and call me, sit down and ask me, my daughter, what's the problem? He yelled at me, you know?
Yeah.
And he was like, he couldn't understand me. He's like, I don't even know if you're my daughter.
And that's the empathy you were talking about, Richard, right?
You know,
Yeah.
that word coming from my dad. I took you to college. I took you to most expensive schools. And here you are letting me down. And I said, Dad, it's okay. So then from there,
Yes.
I just lived my own life. Me and my daughter, no one else.
Priscilla, we're going to take a very short break. But Richard, what I'm hearing, is it possible that we can spiritualize depression? Is that a possibility that we can connect depression to spirituality? We're going to tackle that when we come back, and we'll continue with Priscilla's story, because I'm sure many of you are wondering, so now, where's the daughter? How's Priscilla? And where's Mujemi? What do we, has there been a reconciliation? Did you ever meet him later on? I know these are questions you have. And remember, keep your questions coming on 0702 969 969. This is the home of Fresh and Classic Hits. We're Pearl Radio 96.9. My name is Tina Nzuki.
And my name is Danko Talako, and together we have
Richard Wafula.
and
Priscilla Ngandi.
hey.
My friend, we are this morning, it's, women and depression is what we're dealing with, and we're so thankful for every text, every call.
Yes.
We were listening to Priscilla's story just before we took a break, and we told her to just hold on while we check in with. Do we say Dr. Richard, by the way?
Please.
Yeah. So Dr. Richard Wafula, he is our.
Me.
Yes.
He's our counselor, our clinical counselor this morning. And he's at the Amani Counseling Center. Spirituality and depression. Do you think there's a tie?
From where I sit,
Yeah.
I think I wouldn't say that there's a connection.
Okay.
I wouldn't say there's a connection. For me, I will look at depression as an entirely, purely a mood disorder. okay, a mood disorder that is characterized by extreme sadness. Okay, and it affects our thinking,
Right.
it affects our feeling,
Yes.
it affects our behavior. However, spirituality comes in handy
yes.
as a coping strategy.
Or coping strategy.
Yes. To the believers, I mean, you can actually be able to deal with depression by prayer.
Yes.
Okay?
Yes.
And so that is how I will connect. Otherwise, I wouldn't see any connection between spirituality causing depression.
Okay.
Unless maybe you have engaged yourself in some, spiritual,
Practices.
practices,
Yeah.
cults,
Yes.
that
Yes.
eventually would actually backfire on you and, of course, cause you
too.
depression.
Okay.
Yeah.
Maybe before we go back to Priscilla, Richard, there's this thing about clinical diagnosis of depression. Most cases we think, I've gone through it, but I never actually thought that it's something that I should get a clinical diagnosis of. And most people don't believe that once you get depression, that it's something you should actually seek a professional help. They only think that if I share with my brother, or if I lock myself in the house
And drink water.
like I'm listening to Priscilla, she's talking, and nowhere am I hearing her being taken to hospital, ama kuona daktari, or talking to someone to just, So what is we need to lay emphasis on clinical diagnosis. Is it a must, by the way?
Okay, so as you start observing the symptoms, of depression,
Right.
like what Priscilla has been talking to us before we went to break, then at what point do you need clinical, diagnosis?
Right.
When you become overwhelmed.
Overwhelmed.
Okay.
Yes. And what does overwhelmed look like?
And I'll talk about it. But also when these symptoms are persistent for a period of 2 weeks and beyond.
2 weeks?
2 weeks.
Okay.
Boss, some
So
of us
if
is
you
1 year,
experience-
5 years.
That's what I'm saying. If you experience confusion, if
Right.
you experience anxiety, if you experience insomnia,
Right.
if you experience forgetfulness,
Forgetfulness
yes,
Is the word.
Wow.
low energy and all that consistently for a period of 2 weeks and beyond, then at that particular point,
You're gonna
we
need
advise that you're going to need a clinical diagnosis. There are levels of depression. Okay?
Okay.
And when you go for the clinical diagnosis, your doctor, depending on, your score, will actually let you know whether you have mild depression or you have severe depression. Okay? As a psychologist, I use various tools, to administer, that test, and therefore, depending on how you score,
Correct.
I'll be able to tell to what level.
To what level?
Okay?
Yes.
To what level. Now, there are those low levels of depression which does not require clinical intervention.
Right.
Okay?
Right.
It perhaps will require just therapy.
All right.
And we use cognitive therapy and other forms of therapy to be able to help this person.
Correct.
But there are those levels that it will be important to not just, go through therapy, but also go through treatment.
Right.
Okay? So, depending on where one is, then this doctor will be able to advise, or the psychologist will be able to advise which way to go.
All right.
Richard, here's a text. I've been battling depression for almost 7 years in my marriage.
Yeah.
If you're listening, by the way, we'll get back to Priscilla's story in just a bit. But the question is, I've been battling depression for almost 7 years in my marriage. But now that we separated, I stopped taking the antidepressant. Can one have a relapse?
I'll be keen to understand what made her stop taking the antidepressant. Is it that now that she's out of that toxic relationship,
Maybe.
perhaps she's functioning well? Okay? Because when you talk about our mental fitness, mental health fitness, we're talking
Yes.
about 3 components.
Yes.
We're talking about our social component, how are we functioning socially,
That's right.
Correct.
how are we
Yeah.
functioning mentally,
Yes.
and how are we functioning physically. It's a state of complete physical, mental, and social well-being. So if she has stopped using the antidepressants, will it mean that she's now functioning well on the 3 fronts? Or would it also mean that the trigger to the depression has now been able to be dealt with? Okay? Perhaps the answer is yes, and that is why she has stopped using the antidepressant. However, it's just to also let her know that you can actually fall back.
Oh, relapse.
The relapse.
Okay? You can relapse, and especially if subjected to a similar or same situation that triggered the depression. In fact, those people who have suffered depression are highly likely, if not managing well, to relapse. Okay?
Okay. I'm sponging. We call it sponging.
Yes,
Yeah.
sponge method.
Wacha ni sponge.
A sponge.
Priscilla, ma.
Yes.
Da, tutuonge tafadhali. Take us back.
Yes.
So now, Priscilla, you have decided I'm going back for now my 13-month-old daughter. That means she's a year and a month old.
Yes.
I've gone to get her back.
Yes.
Are you still feeling? Do you still have feelings of what would you call it? I can't say antagonism or feelings of this is my child. I know you, but I still can't feel you. Are you still having these feelings even after you went to pick your child from your mother's place?
Yes, please. I have battled that feeling up to even still right now. We still have some issues because I find that we are not that close.
Right.
We are not. Because she would come talk to me and I'm like, Mom, please don't disturb me or don't waste my time. So it's something that I'm trying to solve it.
I hear you say trying.
Walk.
So is this
Yes,
currently?
I am. It is. It
Okay,
is still.
okay.
And not because the father walked away. It's something that it has been there.
Okay.
Yeah?
Got it. Yes.
And coming out of it, I believe it still needs time.
It still needs time.
Yes.
Did you ever have a relapse, Priscilla?
Yes. Now, from there, we stayed like 2 years, 3 years with my daughter.
Okay.
So when she turned now, that was around 4 years.
Yes.
I meet someone.
Okay.
Yeah. I meet someone and we decide, I think we can have something, a relationship.
Okay.
So we try that and it never worked out. So I decided just to stay in the room, my bedroom. I remember I did not go to job like for 2 days. I switched off my phone. And in my room, I used to have some different medications, Augmentin, Panadol, Septrin, all that. So I was like, in this life, I don't feel like I'm needed and no one cares about me.
Oh, Lord.
So even I forgot that I had a daughter in my house.
Correct.
And the man had stepped out.
Yes.
So I asked for a glass of water from the same daughter. And she came in and she was like, Mom, have this. And I took like almost, there were 50 tablets mixed. And I went to bed.
Wow.
So when I went to bed, I just woke up and found myself outside one of the hospitals. So one of my friends, my daughter happened to, because she knew the passwords of my phone.
Thank God.
And she knew the name of the pastor that we used to go to visit for prayers and any functions. So she was like, she called him. And the guy was like, Zach was like, I'm not getting what this baby is saying. Luckily, they knew where I used to live. So the guy just drove immediately with the wife. And they came to my place. And I was carried and clinic. So when one of our doctors, he's one of our Jubilee doctors who sees the staffs. And he was like, no. What did she take? So they had carried all the boxes, the boxes,
that was there.
And there was a knife beside me. Yeah. So from there, the doctor was like, Priscilla, I will not release you to go home. You need to see one of our doctors.
Right.
So Dr. Kitazi was called in. I was admitted for 2 weeks.
2 weeks.
2 good weeks. I was taken to an isolation room where there was no, you see, like a window where you can decide to
jump
or and the door was locked. So all I could do inside there was just scream. Scream, scream, scream. Pull my hairs. Yeah. So one day the doctor walks in and he's like, Priscilla, we need to chat. And I was like, I don't need to chat. Don't waste even my time. What do you want from me? The doctor was like, Priscilla, you listen to me. You will. And she was like, Priscilla, let's take a walk. So we walked around the hospital. She would take me to the patients who are also admitted with the depression.
Right.
And I would listen to their
Stories, yeah.
So when I listened to one story from a lady who was married to a foreigner,
Yeah.
that story really challenged me and I got strength.
What was the story?
The story was this lady apparently just met the foreigner
Yes.
from nowhere. They got engaged, did a very big wedding. Then 2 to 3 months down, the guy started mistreating the lady. So this guy was in a different cult.
Oh, okay.
So the guy would use snakes on this lady. Yeah? You can tell.
Okay.
So from there, I listened to her and I was like, I need to get strength and leave this place for my daughter. So now my memories now started going back.
Yes,
So
yes.
I called my dad and I told him, Dad, listen, I am sorry for whatever I've done, but I need my daughter to come to the hospital and we need to talk.
Wow.
So, and my dad said, no, we'll do that when we go back home. So I was discharged, went home. But I was very irritable, number one, moody. I couldn't dress up. Trust me, dressing up was a problem. Going to shower was a problem. Trust me, eating was a problem. I remember I was around 68 kgs. I went to 50 kgs.
What?
I could not eat, just lock myself in my room. And once I would go to job, I would report to job. My manager would call me, why are you late? And I used to look at him, and ask him, who the hell? And I would just walk out.
Yeah.
And I thank God for that manager, for Maurice.
Yeah.
He really knew what I was going through. He knew my story and he encouraged me. But even through that encouragement, now I ended up now to clubbing.
Okay.
I would club. I would leave job 7 p.m. My work of place, town, Ngara, where, home, change, come back to job.
You were not sleeping?
Oh, you leave the
sleeping.
club in the morning, go shower,
change, come to job, and I would work.
You'd put in time for jobo.
Yes. I would set my alarm so well.
It's coping strategy.
That's a coping strategy.
Yeah.
She's like automatic, right? She's on autopilot right now.
Yes.
Yeah. I am not taking the drugs now. I have stopped.
You know what really deeply disturbs me is because there are people like you in society and we look at them judging. We judge them.
You judge.
And we don't even like them. We point fingers at them. We have friends who we say,
Friends, we have relatives.
even brothers are like
Sisters, yeah.
Bad company.
Yeah, not knowing that it's an underlying issue that we should have
dealt with.
Because I remember my neighbors.
Yeah.
I would hear them speaking out and saying, huyu ni kama anafanya kazi ile ya usiku pale Koinange Street.
They thought you're a prostitute?
Yeah, they thought I am. So me, I just kept on assuming them. I would go clubbing, I would drink alcohol until morning. I would go with my card ATM. I remember I would swap. Pesa zikishaisha, I used to have a card, the insurance card that we use.
Yes.
So even sometimes I would confuse the bartenders. You just tell him,
Swipe the insurance.
Toa
Yeah.
pesa zenye. You know, you're in that state of you don't know yourself.
Yeah.
You don't have hope.
Priscilla?
You ask yourself, why am I living?
Yes.
That's a question some people are asking
You are
right now.
hopeless.
Sense
Why
of
am I living?
hopelessness.
Yes. You don't feel like talking to anyone. You just want to be by, just alone.
Yes.
Yeah.
So I went on like that. I was taking the drugs. Then I happenly meet a guy, a foreigner. He's a Muslim.
Yes.
So he could tell that I was not okay. So what he used to do, he used to come to my house very early in the morning. wake my daughter up, make breakfast for her, and take her to school.
Wow.
That's what he used to do.
That's what the guy used to do.
You see how God uses different people.
Wow.
Wait.
Yes.
He's a stranger.
Yes, he's a stranger to me. He lives opposite. I'm B, he's A something.
Yeah.
So you'd come in the morning, I am asleep. I can't hear anything because I'm drunk, you know?
Wow.
So you'd walk in, dress my daughter, you'd ask my house help, do you have everything? The girl will say yes. So you'll drop my kid to school, come back. I'm still asleep. He would not talk to me. He would go to his house, prepare something, bring to my house. So we went on like that.
For how long?
Like I met with this guy 2006.
Yes.
So we went on 2007, 2008. So I was like, this life, So I just moved on like that with that life of clubbing, blah, blah. I clubbed until the last minute. This guy was like, and he said, enough is enough. You need to stop clubbing. You have a daughter. Don't show this girl
This kind of life.
You have a very bright daughter.
Yes.
So stop. Wake up. What do you need? Is it alcohol? And I said, yes. So you know what he used to do? He would go to, because he's a Muslim.
Yeah.
So he cannot use his cash to buy alcohol.
Yes.
So what he'll do, he'll call friends and you say, guys, I need your help.
Nilete
ABCD. So he would come, remove all the foodstuffs from the fridge and stock it full with wine.
With alcohol?
Guarana, you know.
Yes.
So he'll tell me now, you need to stop to go to club. And I was like, I need to stop. So I was like, okay, I'll try. I'm not going to promise you, but I'll try. So I tried for a week. It did not work out. So I went back again clubbing. You know, and I'm still taking the medications. So one day when I was in that club, I just had a voice. Zile za, Mama Megan, what are you doing here? What time is it? Do you know, I left that club. I was in high heel shoes.
You ran.
And in a short skirt. I wouldn't go clubbing to get a man, no. Just to hold the noise, the music. And the dancing.
I know that, yeah.
So I left. Do you know, I reached a place where now our stage, nikashuka mat tu vizuri za Kasarani.
Yes.
Nikatoa zile palms na nikaziekelea kwa kichwa. And miguu mpaka kwa nyumba. So I did not have vifunguo za nyumba.
And where were you staying?
Kasarani. So I went. I knocked the gate. No one opened. My phone, it's off. Nililala kwa nyumba ya watchman until morning. 6. I remember I'm supposed to be working. It was on a weekend. Friday, Saturday. Gate was opened, so I rushed in. Changed. Even I did not say hi to my baby girl. Nikatoka. I changed and nikaenda kazi. I used to work like that and no one would tell. Singe stagger or vomit ama nini. No. Actually, I would work and go home.
Priscilla,
What a story.
Yes, and we need Richard to analyze this. Wow. We're going to take a break as we get ready for news.
Yes.
Mwanye Priscilla. So, I just need to. You're fine? Okay, you know.
Yes, I'm good to go.
You're going to tell us how you got out and got here.
Yes, because someone needs to hear this.
Someone needs to hear this. Mental health.
Yes, we'll talk about
what we're discussing this morning: depression and women.
Yeah. Depression
now. Kanye West. You can hear what he's going through.
Right.
And you see, it comes down to now relationships.
Yes.
You can see the tie almost, and then you can also see there's that bond between your thought life, your mindset, and depression. Yes. We're in the studio with Richard Wafula and Priscilla Gandhi. Wait, who's Ngina? Do you have Ngina? No. So we'll go with Gandhi today. And we're so thankful. Priscilla is telling us a story about her situation with depression. How old is your daughter right now?
Oh, she's 10 years old.
Right.
She's 10 years old.
Yes.
Do you have a great relationship with her right now? Or you still?
It's working. It's
It's
coming.
a work in
yeah,
progress.
it's
Okay.
coming.
Okay.
Yes.
Do you have a steady relationship now? Are you working? Are you in school? What are you doing currently?
Currently, I'm working and I'm still in school.
Oh.
Actually, this is my last semester.
Oh,
yeah.
hallelujah.
Then I'll be graduating in November.
Wacha tukupatie arerere.
Yes.
What are you graduating with? What are you?
Studying, yes.
Current, I'm doing a bachelor in health system management.
What?
It's something that I need to come out there. I feel I need to be a leader outside there
I like that.
and manage some things that I see that are being left out. Yeah.
I'm going to take you back to a certain situation. I hope it doesn't trigger anything in you. Richard is here. He's probably going to sort that out quickly. Did you get time, or did you find a place in your heart to forgive the man that started all this? The man who rejected his own child. In rejecting his child, he rejected you and set you up for this downhill, course.
It took a while.
It took a while.
Yes. It took a while because I remember that was 2015. 2015.
Okay.
When I moved now to Kasarani.
Yes.
With my daughter.
Yes.
And the foreigner guy was just living across.
Yes.
So during that period, I got a thought. This is something that I've never shared
Yes.
with anyone.
Yay,
apart
may the
from
best. Okay.
apart from my Caesar, she
Yes.
could tell there was something that I was planning, but she couldn't pick it up.
Right.
My last born sister.
So you got a thought.
So a thought just came one day, and I just dressed up so well, and I went to Dandora. And I started asking for the guys, the hit, the guys who can do a job just, that thought came.
You were looking for a hitman.
Yes,
Okay.
that was the word. So I went somewhere at a corner and I sat there.
And why were you looking for a hitman,
I just
Priscilla?
wanted someone to just finish off that guy.
So the pain was still there.
The pain was still there because I realized that I lived with this guy for 7 years.
Correct.
That time I was working. He was still in school doing law. We had an account together. And this is something I tell women there outside. If you are working, it's good to open up. But sometimes I feel you need to think twice. Even if you're engaged to someone, because what I went through, that guy I used to work, I wouldn't take an off. I would work until Sunday. Holidays I would work. And he used to empty my account.
Let me tell you something.
Yes, tell us.
So women out there, even if we are working, we need to be sharp. We need to wake up.
I love God, Priscilla.
We need to wake up. Don't trust someone because you are living with someone. That person can change any minute, any time.
Duncan, I love God.
I know.
But I'll have a conversation with God about that. Nyundu, what?
So this guy messed up all my accounts.
Yes.
No.
Cleared everything.
Clear everything. Kumbe back there was a lady that he was taking to school.
No.
With the
Wait, he was
man-
taking to school.
Yes, Egerton University.
Ekaitwa boy, Shanda.
Kwanza huko ndo mimi nilisomea.
Jesus, Shanda.
So
no.
the guy was paying fee for that lady.
Well,
With
you were
whose
paying
money?
fees for him.
No, for him, it's the mother. He comes from a well-up family. Yeah? There are those guys, Yani, they were blessed with money. But now you would use my money from my account to pay for another woman for fee. So all these, I didn't share with anyone. So here, my mother is gone. The guy is gone. Then from there, my grandmother, who took care of me when I was 6 months old in Nairobi.
Yes.
And left my parents were staying in Westlands.
Yes.
So my grandmother decided, let me take my granddaughter. So I stayed with my grandma.
Correct.
My grandma dies. Yeah? I bury my shusho. Then from there I stay like another a year. I bury my grandfather.
That's too much in
Yeah,
one.
so all that in me.
Yes.
And I never used to talk to anyone, even my dad. I would fear going to him. I did not have friends. Yeah, I used to be just by myself. So when all this came up, I decided now that I need to kill myself, blah, blah, blah. All that started clubbing with all that in my mind. So it reached a point and I said,
Yeah.
enough is enough. I need to change my life.
Dr. Richard, when
Yes.
we talk of premeditated murder, is it really?
At what point do you get?
Yeah, because
You know, at the
Do
end
you
of your
hear-
rope, to an extent, you're like, you know what? You try to kill yourself. You're like, "Apa,
I'm
nah."
at, yeah.
Then there comes the stage where now it was denial. Now it's blame. So that person has to pay.
Has to pay
That's the cause
for the
of all my
pain,
pain.
all the pain. Yeah.
But you see, pain causes rage. Eh?
Okay.
Okay. So that pain that Priscilla is, talking about.
Right.
That causes the rage.
Yes.
Yes.
Okay? And I mean, when you get there, really, there's nothing that will come on your way to, stop you. Luckily for her, I mean, she didn't get to the full course of this plan.
Or finding
But-
the hitman.
But I mean, as a human being, how much can you take in?
Good question.
How much can you take in? And what kind of support are you getting? She has rightfully told us that she didn't have someone to talk to. So she took in so much, bottled it up. The way you open a kasoda after
Umeshake.
Yes, yes.
Yeah.
Yes.
That's how I can explain, our emotions in that context.
Yes.
And in that particular point, when you open that bottle, you're in for a mess.
Is that what she should have done? Found somebody?
Found a
Yes.
release.
Yes.
Found a release, found where to vent, where to pour. I mean, where to just even, empty.
But how many people
herself.
have that avenue today?
Yeah.
Someone is at work right now listening, going like,
Yeah.
I need someone to talk to
In fact,
right now.
that's to give you a statistics on the current mental health state in our country.
Correct.
Up to 75% of Kenyans cannot access mental health support. Up to 75%.
75%.
And it could be more. It could be more.
And when you say mental health support, you simply mean a person who will sit down and listen without judging.
Yes.
We don't have that in Kenya.
I mean,
Dango?
developing, countries, and Kenya being one of them, for her, it would have been different if, for example, she had someone to just talk to without feeling judged, without feeling labeled. She has told us on how she was being referred to as a prostitute.
Yes.
Or as, people saw her as immoral. You're going out to drink, you come
But
back
that's
home
not
in
who
the
she
morning.
is.
That's not what she is. In fact, us in counseling, we normally say that when you want to achieve a behavioral change, separate an individual from
their
the
deed.
behavior.
Yes.
Separate the individual from the behavior.
From the behavior. I mean, don't look at Richard as an alcoholic.
Yeah.
I mean, separate Richard from alcoholism.
You know that's hard to do.
You'll
you
achieve,
know that.
you'll achieve the intended goal. But if you pile all things together,
Ridicule and all.
it's going to be very
But
difficult.
now the question I would ask, and that's and I want us to lay a lot of emphasis on this.
Yeah.
You've been at Amani Counseling Center
Yes.
for those many years.
Yes.
How easily accessible?
Accessible.
Like like there was a time, I'll tell you, there was a time I was depressed and I was asking, where is this Amani? I was told, oh, in Bagabi, go where? And I wanted to just walk in. How can anyone who's depressed right now, right now, they're listening, they're typing, they're
Yes.
chatting and tweeting.
Yes.
How accessible is it? Like I can just walk in. I don't have money.
Danko, even before I get to that and to that question,
Yes.
one of the barriers to accessing mental health is not even the cost; it's the society itself.
That's true.
People
Yeah. Yep.
have been telling us, that. And interestingly, some time back, we had a client who, told us that anytime he could get to their money gate, he looked left, right, forward, backwards to see who's watching.
Yes.
Before he can actually
Walk
pop in.
Yes.
Because of the stigma.
The stigma that is.
Just like when you're seen, maybe in the past or even now, walking into maybe taking your, ARVs.
Yes.
People, I mean, you're queuing there. What are people saying about you?
Yes.
This is an immoral person. This is an immoral person. So when you're seen to walk into a mental health facility like Amani, then there's that fear. What will people say about me? So that is just to tell us that is a barrier in itself to access. But I want to say this to our listeners this morning, that mental health issues are not, meant for animals.
Yes.
Oh, yes.
Yes.
Mental health issues are meant for us human beings.
Right.
Going through normal issues, and we should accept them.
Richard,
we should accept them.
what does that say about the emotional intelligence or emotional state of our society?
Yes.
We are an angry lot.
We are an angry lot.
Ongeza corona hapo sasa.
Ongeza leadership.
Yes.
2 years ago, I did a research newspaper Standard on the state of happiness in Kenya.
I saw that. I saw that. It was you.
Yes.
Wow. I saw that.
I think it was
Yes.
the other.
Yes.
Okay.
Yeah.
Well,
Yes.
we'll tell you who it is.
And we ranked poorly.
We are
Yes.
okay, what's a percentage? Just give us we'll start being happy now. What's a percentage?
Actually, more than 50% of Kenyans are an angry lot.
Where does this stem from? What's the root?
It stems from, a number of things that
Harsh
are happening.
economic times.
Harsh economic times, social injustices.
Injustices, yes.
Now
Political instability.
So you can imagine, putting all that. And of course, yes, I know there's a fee attached to the mental health service.
Correct. Yes.
But I also want to say, and to our listeners outside there,
And to your fellow councillors.
and to my fellow councillors, that,
Yes.
we, as a money, we have been reaching out.
Correct.
In fact, I want to say that we have a project, with one of our partners, Crew International Kenya, where we are offering free counseling service for gender-based violence survivors.
Amen.
Hallelujah.
This is good. For
Best
gender-based.
violence survivors. GBV is not just physical, it's emotional as well.
Yes.
Listening to Priscilla, I could easily classify her somewhere where I will, be able in this project support her through what she's going through.
Correct.
Because there's a lot of emotional
Violation that has happened
violation
on
that
her
has
person.
happened on her
Yes.
part.
Yeah.
But we also listen to case. There are those people who walk into a money and because of their nature, of their social or financial position, actually, their cases are heard and the fee is waived. Or they're given a subsidized rate. So I just want to encourage, those who are listening this morning, that don't wait to deal with a mental illness. Don't wait to deal with a mental illness. Prevent the mental illness by reaching out.
This is a good time to give your contacts now.
Yes.
Write down the name Dr. Richard Wafula or just my friend Richard Wafula.
Yes.
And his telephone number is
0721 416 077.
you need to say that again. One slowly.
0721 416 077.
All right.
Where can you locate us? We have our head office along Bagathi Road. We have our town office where actually I'm the regional coordinator in our town office.
Well done.
We are situated along Tomboya Street in a building called Mwalimu National Circle Building.
I know. Yes.
8th floor. You'll find us there. Amani, we are in Mombasa. We are in Nyeri. We are in Kisumu. We are in Siaya. We are in Ugunja. But we are all over.
Right.
We are all over.
Now that you're I think you're the right person to ask.
Right.
What is the government's position on mental illness? And is there any state machinery that has been set in place to assist, maybe hotlines or I don't know.
Yes.
Maybe you would know.
I want I remember a speech by Our Excellency the President Uhuru Kenyatta. I can't remember the year, but he was in Narok, if I'm not wrong, when he talked about the importance of mental health.
Yes.
And after that, he directed that a task force should be put in place to actually be able to listen to, issues that are relevant, are important regarding mental health. This task force led by Dr. Frank Njenga did a very good job. In fact, as a money, we did give our submission.
Right.
And the report is out there. It was launched last year before COVID.
Yes.
It's actually in the implementation process.
Right.
And so the government is really keen. Is really keen on mental health.
Right.
Yeah.
Oh, wow.
Yeah.
Priscilla, I really, man, I want to
What was
wrap
the-
your story.
What was the turning point? Because
Yeah, there must have been a turning point. When did you?
so how do you move from you're looking for a hitman
Yes.
I'm
to
seated
finding
somewhere.
Jesus?
You-
Yeah, looking for the guys. You know how Dandora is.
Yes,
Yes.
that's
I
my
have
hood.
never been there.
Yes.
But I went there that day. I usually hear about Dandora.
Yeah.
So I looked at the guys and I'm like, now, how much should I pay them to do that job? And the job should be clean.
And not linked back to you.
Yes.
In a movie.
Yeah.
Yeah.
So I sit there, I think, and then when I'm just there, I just hear a voice. I'm like, someone is talking to me, but I can't see the person. A voice telling me, Priscilla, you need to wake up and go back home. So I'm like, who is talking to me? So I move around the place and I'm like, I need to go home. So I get back home. I hold my phone and I call my other Caesar and I ask my sister, where are you right now? Are you at your place or you're somewhere else? And she's like, I'm at home. So she's like, what's the problem? Why are you calling me at this time? So I just said to her, I need your help. She's like, help? Now I'm thinking of now hiring a gun.
A gun.
Now a gun.
So that you can do it
I
yourself.
can do it myself. So when I did that,
Yes.
my sister was like, you are crazy. And she hung up. So when she hung up, so I stopped now thinking of that.
Okay.
Yeah. So I grab onto my Bible
Okay.
and I just start going through the verses. I don't know, Psalms, Jobs, do what, and I'll go back to sleep. Those days I used to sleep. I loved sleeping. Yeah? I would sleep the whole day and wake up at around 9 p.m. and start doing my things.
The whole day.
The whole day. When I'm off, I would sleep the whole day. I would not eat, no shower. You get? So this foreigner,
The next door.
now the next door,
that our
Yes.
foreigner
now
next door.
took over my,
Your entire life.
yes. So he would come, wake me up, open the shower,
Aya.
and they will push me in.
Ingia huko.
Oga.
Ingia huko oga.
Wow. Yeah.
And he fired the house help.
He fired the house help.
A man.
Where's your daughter
Yes.
this time?
We are still with her there.
Wow.
And he did this for how long?
He did that for, I think, 6 months.
When did he get tired? Did he get tired?
No, he never got tired.
Resilience.
He never got tired.
He's making us other men look bad.
What he did, he went
Yeah.
on and went on and went on.
Right.
Yes.
He would even come, take my daughter to school, do everything in my house,
Yeah.
pick me at work, drop me to my house, and he would go back to his own house.
Right.
So one day he sat down and he was like, Priscilla, I am a Muslim, you're a Christian. And you know, these two things,
They don't mix.
As your
they
maternal-
don't. But there's something in me that is pushing me towards you. So I'm like, even for me, I don't need a Muslim guy. For what? I don't need to put those bui, Quran, bend there, pray, I don't know how many times. I'm not interested. So he tells me too, I'm also not interested. Because I don't know what my parents back in Khartoum
We'll say.
will say.
He's from Khartoum.
He's from Khartoum.
He's a foreigner. He's Sudanese.
Sudanese.
Yes.
Where?
From Khartoum.
Priscilla.
So we sit, we
Hey.
chat, and we say, this one cannot work. So now I started again. I'm on medication, but now I'm not taking alcohol.
Okay.
But I just need to a nearby club and just dance and come back home. So it went on. I stopped drinking.
Okay.
So he will bring alcohol in my house. I will take all the alcohol, dump it.
Dump it.
Yes. Or I will call neighbors and tell them, guys, kindly enjoy.
Penny.
Jibambe.
So Sayo, hata zile drugs nimejiambia hizi antidepressants I don't need them. So nikajiambia I need to style up. So nikaamka, I started showering. I would dress up so well. I would go to work. I would not talk bullshit. I used to talk bullshit to bosses. Even, you know, you tell me this, I'll tell you this. So I started changing kidogo kidogo. Sai hata church nimeacha kwenda. I have stopped, and I said I am going to do it. I'm going to fight it by myself.
All right.
Then I decided just to get someone at place of work. In our institution, I work in a hospital.
Yes.
We are given Tuesdays for free counseling. So I used to go there at 9. So I would go, I would cry, then I'll come out smiling, you know, singing. So it went on. 2017, 2018, I'm good to go. See, in the club, I'm not feeling like
you're depressed anymore.
I'm still feeling that kuna zile sauti zinakwambia simama kwa barabara, you know, ugongwe na gari ishe. Yani you still get those thoughts. So when I would get those thoughts, I would say to myself, so after nikisha gongwa na gari,
so
what next? Huyu mtoto atabaki mahali, atakuwa house help. So nikakumbuka my dad ameoa a stepmother. I said to myself, no.
Not happening.
It's not going to happen. So now I started working on myself. I would wake up in the morning, I would pray, naingia ofisi nafanya kazi yangu vizuri. Jioni ikifika 7 p.m. I leave work of place and go home and find the guy there. So one day he said, enough is enough. We are not going to live separate. So he gets a house.
Okay.
A self house contained mahali hakuna jirani, hakuna nini. So one day nimetoka job, I go, I find my things are missing. My daughter is also missing. So I'm like, the house is empty. So I call the caretaker and he tells me, ulihamishwa na ule Sudanese. So they used to call him Sudanese. So me, I'm like, this Sudanese, what the hell? So I call him and he says, come home. He gives me direction. So I go. I find them in the house. Wamepanga kila kitu, everything is good to go. So he tells me, it is me and you and her. We don't need a house help in this house until things work out. So he used to come, he used to talk to me. He would tell me, I don't understand.
Stop
I don't
calling
understand. I don't understand Kenyan men.
He said that?
Yes.
Hello, Richard. Hello, Duncan.
How are you?
Hello, DJ Joe, the DJ.
I'm actually Malawian.
No.
I'm a Burundian.
But you're Burundian. Yes, Joe, the DJ, you are who? So he said he doesn't understand Kenyan men.
Yes.
He doesn't at all.
Maybe we can put it in silent.
How would one reject his own
He's
wherever?
Thanks.
Yeah. So me, I would face him and I would say, I don't know.
Yeah.
So he tells me as a Muslim, I would marry 10 wives and I would never let my kids suffer. Even the mother. I would still bring them together
We need to
and make
discuss
it
that.
work.
Yes.
Yeah? Let it work.
Let it work.
As a Muslim man, you stand up for your house. You don't need people to control you from outside.
Where? Good morning, Christian men.
Good evening,
You
viewers.
see? And he tells me, I am not going to convert you to a Muslim. I'm not going to change anything. You and your daughter, when the time comes, if you feel like you want to be a Muslim, you're welcome.
It's your choice.
It's your choice.
But for now, I just want you to get better.
I just want you to get better. And I'm telling you, I don't regret meeting that man.
Is this a current situation as you're seated right here?
Yes. I would come from job. He would look at me and he was like, is there something wrong? Something missing? Did I do something wrong? Someone at workplace? And you see, now this is the thing that I never got from my first marriage. We
Yes.
never used to talk.
There was no talking.
I would come from work, go in.
Right.
I never used to cook for him. The mother used to do everything. Yeah? You just come, find the mother has cooked mokimo, so you guys, you just enjoy, eat, shower, go, sleep. That was my marriage. We never used to talk of anything. Even when I went for my maternity, he doesn't even know who paid for the bills. You know, I did everything by myself. I discharged myself, paid the bills.
And did everything.
And did everything for myself.
Wow. What a story. So mentally, where are you right now?
Mentally.
Right now, I would say I am okay. But if something happens or someone just says something nasty to me, it triggers it up. So that's what I'm still working on. Yeah, even if someone comes and says something, or maybe my boss at work comes and says something that I don't like, nowadays I try to control. Because I tend to be very irritable and very, sometimes even I feel like,
punch someone.
there's a punch.
Is this normal?
Yes.
Is this normal, Richard?
It is normal. Very normal.
Okay.
Yeah.
Like you can
and
quit.
does it Inaisha?
Yeah, it goes away with time.
It goes.
Yeah.
Like for me, it goes. But when something triggers,
What would be your trigger, Priscilla? What's a trigger for you?
like now, my trigger happened, that was last year, but one.
Okay.
Actually, I was good to go.
Okay.
So I was working in theater.
Okay.
So when I was working in theater, we got a new boss. So the new boss comes in from Canada.
Male or female?
A male.
Okay.
And it's like he doesn't, I don't know, it's like he doesn't like female, or I don't know. So he comes and he says, I need changes to be done. So the changes were done.
Okay.
So I was moved to pediatric ward.
Okay.
Yeah, from theater to pediatric ward.
Yeah.
So they gave someone that position of mine. They replaced me with now someone new. So I walked to PIDS. And you see this change of going somewhere. Change, we don't... Yani change doesn't come that easily.
Correct.
You
Yes.
fight it before
Correct.
it.
You
Yes.
acclimatize.
You resist
Yes.
it. Yeah.
So it really, I really tried fighting it. So I relapsed.
Oh.
Relapse.
Yes.
Yeah.
You
I would go
relapsed, yeah.
talk to my bosses and they would look at me and like, we don't care. So they would take me department to department, up and down. So I would ask them, so what's my JD? I need to know what's my JD. Am I in PIDS? Am I in maternity? Where am I supposed to be? So I talk to them and it's like they don't, no one, So what I did, because now I went back to started seeing now a new counselor, because apparently who was treating me transferred now to private.
Okay.
So I went to see Nabiso and Nabiso listened to me and I was given now the drugs back again. And I hated the drugs. So I started taking them.
What do the drugs
What
do
do
to
the drugs do? Yeah.
What are the
As in,
effects?
the effect, you sleep,
Yeah,
you're just there.
zone out.
Yeah, you're just there.
It slows you completely.
Why don't you just have something that's normal?
You see, you're dealing with an elation of an emotion.
Okay.
Okay, an elated emotion.
Okay.
So for you to calm down, I mean, you need to have those antidepressants to try and
Calm your-
suppress your
Kuzi.
The nerves,
Yeah.
So it slows you down.
It does.
But when you
And
come
you
out, don't you
become
just come
so
out so
dull.
duh?
Can
Yes,
you imagine?
I mean, those are side effects of antidepressants. Those are the side effects of antidepressants. And that's why I've said in this show that, I mean, it's good to take care of your mental health.
Right.
And avoid getting to mental illness
Yes.
that will necessitate you to get into such, treatment.
Treatments, yeah. Wow.
I wanna quickly. I want to close this down. You're going to give us your contacts one more time. But Priscilla, anyone listening to you right now
Yes.
that is in that situation or has just relapsed into that situation, you must be having something to tell them right now. You had a baby, you didn't want that baby, you had a relationship, that thing broke you, and now there's a man who's got in your house, he's taking good care of you, taking good care of your daughter. You're in a good place and you're getting there. Healing is a journey. It's a process. You're still walking. You're getting there.
Yes.
You think you'll ever get there?
Yes,
You
I
think
will.
one day it's gonna be all okay?
It will.
I like that because that's faith.
Yes.
And faith is the substance of things not seen, the evidence of things
Hoped for.
And that faith is what's gonna get you there.
Yeah.
Now, regardless of religion, whether he's Muslim or Christian, someone who's listening to you wants to know, right now, what do I do? Apart from now going to contact Dr. Richard Wafula. Right now, Priscilla, what do you want them to know? And just be open, be honest. This is a non-judgmental zone. We don't do judging here.
Yes, right.
Yeah. Ongena.
For ladies out there and men
Yes.
listening to us here, if you're in a relationship that is not working, number one, don't force things.
Don't force.
Don't force yourself to love someone. Don't work hard for a relationship that is not working. Because at the end of the day, you will be depressed. And the other person will be moving on with his own life or her own life. So someone needs to know what he or she needs in life. And it's not only in relationship.
Right.
Even if you have financial breakdown, you know, those such issues, you need to come up with a way.
Okay.
Yeah? If your salary, you cannot afford a house or you cannot afford a school for your kids, you need to move to a place where you feel that is within your budget. Get a house that you feel you can pay, a school, even if it's a kanjo, it's for the time being. Because I believe you will not be there permanent. There's nothing that is permanent.
There's no situation.
There's situation that is not permanent. Everything can always, with God, things change.
Yeah.
That is what I believe.
Yes.
Wow.
So for me, if you feel like you are getting some symptoms, you are tired, you are moody, your activities, as in how you do your things, have changed, you need to speak up to someone and get help.
Get help.
Don't keep it to yourself.
Don't keep it to yourself.
Even if people will laugh at you, let them laugh. At the end of the day,
It is for your well-being.
yes,
Does Megan understand the situation you're in? Megan is her daughter.
she does.
She does.
Yes, she does. Sometimes she would even walk to me and say, Mom, everything will be fine.
Wow.
I like that.
A 10-year-old.
Everything will be fine.
Now, if we are to ever forget anything today, maybe not forget the fact that at the end of it all, God loves us.
Yes.
Yes.
And He wants the best for us.
Yes.
So I'd actually throw the last question to you before you give your contacts. What is that one life skill? What are those life skills that we need to employ? Because we have already learned the society deems depression as something that is an outcast phenomenon. So what are some of the life skills? I know you have tools at your disposal, but I know sometimes you charge for this. But do you have any life skills that you can give right now on air on people who are going through depression?
Wow. First, I want to say that there is no health without mental health.
There's no health
Without mental health. I mean, tell me of anything that you can do, including us who are seated here today, if we were not functioning mentally.
Yes.
We wouldn't have achieved this show this morning and any other thing that you're planning to do in the course of the day. So there's no health without mental health. What are some of the things that will help one be able to deal with, sad moments or depression? Number one, don't bottle up your feelings.
Right.
Don't bottle up your feelings. I hope you're writing. Write it
Don't
down.
bottle up your feelings. The more you bottle up your feelings, the worse it gets for you.
Yes.
Learn to, at all times, you're going through, a situation that is not very comfortable. Learn to deal with it. Learn to deal with it. I
Yes.
always say that it's important not to go to bed when there's something that is bothering you and you go with it to bed. Because when you wake up, it will maybe
Still
have,
remain.
even gotten worse.
That's right.
Yes.
Okay. Number two, engage in social activities.
Engage in social activities.
Engage in social activities. And engage with people around you, those who you can relate with.
Yes.
Identify people you can relate with. Identify support groups
Yes.
that will be very helpful for you at the time of need.
Correct.
We are not islands, as human beings. We are social. And therefore, engage in social activities, engage with people around you, identify support groups of people who will be of help to you. Get enough sleep.
Yes.
Get enough sleep.
Get enough sleep.
I love that.
At least 8 hours if you can afford. Because there's power in resting. There's power in resting.
That's right.
It just helps you to be able to deal, with what is happening in your life. Number 4, exercise if you can.
Exercise if you can.
Exercise if you can is one way of really allowing our body to vent out and to release what is bottled up in us. So if you can exercise, and I mean that different types of exercises that, will fit our bodies.
Right.
Will fit our bodies. Find time to meditate.
Right.
Find time to meditate. Those who can afford will go to yoga. They'll go do yoga. But meditation is a very effective way of also dealing with your stresses. It gives you a new perspective.
I love that.
The best thing about meditation would be, God has really told us who he sees us as.
Sure.
Right.
We are the ones who degrade ourselves. We deny ourselves the joy of seeing ourselves through the eyes of God.
Yeah.
So even meditating on the word of God and seeing his promises and his purposes over your life really works.
True. Yes. So it gives you that new perspective.
Yes.
It renews your strength.
Yes.
Every morning. Every day.
That's right.
It renews your strength. So there's power in meditation.
Right.
Okay.
Yeah.
Eat well. Eat a
Eat
balanced diet. Eat well. There's a relationship between the deficiency of some vitamins and depression.
Wow.
How many
Right.
people even know this?
Yes.
Kazi yako ni
That one
kuku,
lazima
kuku, kuku,
tutarudi.
kuku, kuku.
We're gonna come. That one we can dwell
Yeah.
on that.
Yes.
Yeah, one day,
Yeah.
yes.
Eat well. Have the necessary vitamins required in your system.
Right.
It helps your brain to function very well. Otherwise, then, it becomes very difficult.
Right.
Seek treatment when
Seek
you
treatment,
can.
yeah.
Seek treatment
Yeah.
when you can. It's also very, very
Yeah.
important. And as I end, I want to, still urge our viewers that
Listeners as
listeners,
Nice, even
Yeah,
viewers.
Dunker's viewers, yes.
Yes.
well. Yeah.
depression is a disease, is a sickness, just like any other sickness. Those supporting people going through depression, treat them like patients. Treat them like you'll treat any other patient. Accept them the way they are. Empathize with them.
Correct.
Empathize with them. It's very key. If there's anything a depressed client will need, is a listening ear.
That's it. A listening.
It's a listening ear.
Yeah.
A listening ear.
It's a non-judgmental attitude.
Correct.
It's an attitude of love and care. And I want to, really emphasize on that as I come to the end, perhaps of, my input
Thank you.
this morning.
That's right. Lovely. Just to remind them before, Tina, I think I would like us to just go
To pray.
Just pray.
Okay.
But Richard Wafula's contacts are, he's a counseling psychologist also at Amani Counseling Center. The number is 0721. That's 0721
Yes.
416 077. That's 416077. We're going to put it up somewhere. But the best thing about it is that you can also find contacts on Amani Counseling Center. You can walk in anytime.
Anytime.
In any of their centers in Kenya wide, and you will be received and help. So, Tina, I just want us to go before God right now.
Let's just take some time and pray. Father, we are a lost lot, both as society and both as people who are struggling this morning with anxiety and feelings of hopelessness. And we're trying to grapple with so many things. We're trying to get a hold of this and get a hold of that. And it's not working. We're getting people saying the wrong things to us.
Yes.
Our parents, our friends, our spouses,
Yes.
even our children, our bosses. And there's thus that aching, nagging feeling of hopelessness and distrust that is growing on the inside of us, but that is not who you say we are. And this morning I want to pray for every man and woman under the sound of my voice.
Yes.
That has gone back to settings that tell them this is what we think you are. God, we are asking for your voice to be amplified over the voice of the enemy, over the voice of judgment, over the voices of hopelessness, over the insults, over the violence, over the emotional degradation in the name of Jesus. That which is depressing people this morning.
That's right.
We're asking for a lifting shutting off in the name of Jesus Christ. We know you as powerful. We know you as wholesome. Are you not the Lord that said, come to me that are weary and heavily laden, and I will give you rest. Right now, there's a man looking for rest. He's just needing to rest, God. And he thinks by taking the pills in his hands, that's the rest he's gonna get. Right now, there's a woman looking for rest. And she thinks just by walking out of the house, right onto the railroad track and getting hit, that's the rest she's gonna get. But that's a lie from the enemy. There's a rest that you can give God, a rest that rejuvenates us from the inside out, that causes us to be restored and to be raised up, so that when people see us, they will not recognize us as the people that had been broken and cracked and shattered. You're the God that puts together. Will you not put them together? Wipe every tear. Heal every broken heart. We thank you for Priscilla and her life. And I know she's gonna get there.
Yes.
Because the blood of Jesus that speaks of greater things than the blood of Abel is speaking for Priscilla right now. It's speaking of the love it has for her. That blood is speaking about Megan right now. It's even speaking about that man, the Sudanese who's taken her in. It's speaking about Dr. Wafula this morning. It's speaking about Karaoke, about Jane, about Kiptu. It's speaking about the people that have been broken this morning. And that blood says, I'm going to make it better. Receive what I have for you. I have rest and I have peace. And we thank you for the mercy of the Lord this morning. That mercy that's causing people this morning to turn. So God, we accept your peace. We accept your love. We accept your understanding. Give us wisdom. And tomorrow morning when we wake up, even tonight as people sleep, give them sleep like they've never had before.
Yes, Lord.
So that when they wake up in the morning, they say, this is the doing of the Lord. Give Priscilla rest. Rejuvenate and restore Dr. Wafula and many like him that are helping people. And give my nation, give my people, give us Kenyans, both on social media and physically, the heart to listen and to love on people today.
That's right.
So that you can be seen in us. Give this station, PAL Radio, a voice for the voiceless. Give us hope to give to the hopeless. Help us walk with the blind, to heal the sick and to raise the dead.
Yes.
That is our assignment on earth as
Yes,
PAL
Lord.
Radio.
Yes, Lord.
And we thank you for a station that can show up Christ anytime, any day, without fear and with authority. And we thank you that your name will be glorified both now and forever. In Jesus' name.
Amen and amen and amen.
96.9 FM, Pearl Radio.